Good afternoon, everyone. We are the third group assigned to report this afternoon, and it is about human dignity and human rights, and also public health rights. I am Eden Bete, and my group mates are Cedric Hongko, Shelde Labrada, and Shishan Pacteres. Human dignity. Human dignity means that everyone has the same level of dignity and respect regardless of one's ability, income, age, or social level. That is because we are all children of God, holy and uniquely created in His image and likeness. With this in mind, human dignity comes with human rights, and we all ought to respect others' human rights as well. Human rights. The Catholic Church teaching on human rights is based on its teaching and understanding of the human person. Human rights are the basic rights and freedoms that belong to every person in the world from birth until death. It can never be taken away, although it can sometimes be restricted under certain circumstances. For example, if a person breaks the law or in the interests of national security. And these rights are applicable to everyone regardless of their gender, age, social status, and etc. Pope John Paul II has listed examples of human rights in the encyclical Centesimus Annus, and these are: first, the right to life, an integral part of which is the right of the child to develop in the mother's womb from the moment of conception. Second, the right to live in a united family and in a moral environment conducive to the growth of the child's personality. Third, the right to develop one's intelligence and freedom in seeking and doing the truth. Fourth, the right to share in the work which makes wise use of the earth's material resources and to derive from that work that means to support oneself and one's dependents. And lastly, the right to freely establish a family, to have and to rear children through the responsible exercise of one's sexuality. According to Pope John Paul II, in a certain sense, the source and synthesis of these rights in religious freedom, understood as the right to live in the truth of one's faith and in conformity with one's transcendent dignity as a person.
Now let's go discuss also the basic human and people's rights declaration. For the individuals, society, and the country, we have the natural right to life and liberty and are equally in dignity. Equal concerns and respect for those basic rights should be granted, protected, and upheld by the country. The government should formulate policies, enact laws, and provide mechanisms that are in conformity with universal human rights standards. The government has the obligation to provide the highest standards of living for its citizens by eradicating social, economic, political, cultural, ethnic, and gender inequalities. In the determination and implementation of laws and policies, the government must always respect and consider the concerns of women, children, and youth, persons with disabilities, the mentally challenged, older persons, indigenous and Moro people, the urban and the rural poor, farmers and fish folks, workers, local and overseas, public or private, whether formally employed or not, displaced families and communities, and other vulnerable sectors with a view to ensuring their empowerment. The diversity and plurality of the Philippines must be safeguarded through respect and tolerance. The government must respect and promote harmony and understanding between and among individuals, communities, and people. It must uphold non-discrimination among people regardless of age, race, ethnicity, religion, gender, physical ability, sexual orientation, social beliefs, and political conviction. Cultural tradition and institutionalized power shall not serve as justification for any form of violence, abuse, neglect, or deprivation of human and people's rights. Now, let's tackle about public health.
Why is health important? As human beings, our health and the health of those we care about is a matter of daily concern. Regardless of our age, gender, social status, or ethnic background, we consider our health to be our most basic and essential asset. Poor health, on the other hand, can keep us from going to school or to work, from attending to our family responsibilities, or from participating fully in the activities of our community. In the same way, we are willing to make many sacrifices if only that would guarantee us and our families a longer and healthier life. Everyone has the right to health. It relates to both the right of individuals to obtain a certain standard of health and healthcare, and the government obligation is to ensure a certain standard of public health with the community. The World Health Organization defines the right to health as a complete state of physical, mental, and social well being, and not merely the absence of disease or infirmity. The government should ensure both freedoms and entitlements. The right to health contains freedoms. These freedoms include the right to control one's health and body, for example, sexual and reproductive rights, and to be free from interference, for example, free from torture and non consensual medical treatment and experimentation. The right to health contains entitlements. These entitlements include the right to a system of health protection that gives everyone an equal opportunity to enjoy the highest attainable level of health, access to essential medicines, and the right to prevention, treatment, and control of diseases. Why is public health a human right? Health is a fundamental human right. It is essential for the exercise of many other rights and necessary for living life in dignity. The right to health for all people means that everyone should have access to health services they need, when and where they need them, without suffering financial hardship. In response to the COVID-19 pandemic, governments around the world have implemented public health policies that limit individual freedoms in order to control disease transmission. Policies such as border and school closures, face mask mandates, limitations on social gatherings, and household confinement have been shown to be effective against COVID-19 transmission and disease outcomes.
The 10 essential public health services provide a framework for public health to protect and promote the health of all people in all communities. To achieve equity, the essential public health services actively promote policies, systems, and overall community conditions that enable optimal health for all and seek to remove barriers that have resulted in health inequities. Such barriers include poverty, racism, gender discrimination, and other forms of oppression. Everyone should have a fair and just opportunity to achieve optimal health and well being. In terms of public health and safety of the community, people should get vaccinated at least the majority of 70% of the population. To reduce the death rate, people who do not want to be vaccinated are prohibited and should stay away from public places. The unvaccinated people are the ones who are fragile or unsafe from COVID-19 that causes symptoms or the worst, death. To summarize, every human being is born with fair and equal rights and dignity. It is not a privilege given to people. Rather, it is innate within us. Both of it inherit a connection and are, in some way, related.
Our dignity serves as the foundation for our individual rights. Furthermore, accepting and understanding health as a human rights creates an obligation for the government to ensure access to affordable, accessible, and quality healthcare services. That would be all. Thank you for listening. To God be the glory.